confirmed from testing at the CGTN laboratory. 2,257 cases were confirmed at the Hospital Authority laboratory. Of the 3,806 cases, 60 cases contain the L452R variant strain, and 2,768 cases do not contain this L452R strain. 22 cases yet to be confirmed because the load is too low. Now, there are 4 infected cases, 6,058 cases. 59 cases are local cases. And then so far, there are 30 homes with either preliminary positive cases or rapid test positive cases involving residents and workers. So in conclusion, we keep getting new cases, and there are about over 190 homes with cases involving either the residents or the staff. And there are about 120 plus employees at residential care homes, and 450 residents who tested positive with the PCR test or rapid antigen test. Now we know that there are, close contacts in household, and they may be under pressure, and then people have been waiting for a long time for arrangement. But please be understanding with the frontline staff, including the auxiliary medical services staff or the audio staff. They have to deliver packs and electronic wristbands to people in home isolation. But please be understanding, because there is a surge of cases so substantially, so in some cases people may have to wait a bit longer. And then we've also done some analysis. From the 31st of December to now, there have been 46 death cases. Only 6 were vaccinated, according to our record. For the other death cases, the patients involved did not get vaccinated. And for the 6 patients who were vaccinated, 3 took 3 doses of CoronaVac. 1 case took 2 doses of BioNTech, and 2 cases have had 1 dose of CoronaVac. Now, Dr. Ho, please. Yes, there are 3,312 confirmed and preliminary positive cases in the North Lantau Hospital, Hong Kong Infection Control Center, Hospital Authority Infectious Disease Center, AWE Community Treatment Facility, and public hospitals. There are 2,400 patients in the Penny's Bay Community Isolation Facility, and over 100 patients are at the Tsuen Wan Community Isolation Facility. 15 patients passed away. 264 patients have recovered and been discharged. And the occupancy rate of public hospital beds has reached 90%. That's already the upper limit of what we could cope with. Now, hospital authority staff have been working very hard last night. Now, for patients stranded in outdoor tents, outside accident and emergency ward, they have all been moved indoor. And for the tents, they are now used simply for triaging and testing. Now, it's a tough process to move patients indoor, and I would like to thank colleagues again for their hard work. I'm also grateful to patients for their understanding. Now, for patients stranded in the past few days, our apology again. Please do understand that the crisis is not yet over. We are very much worried that if we have several thousand confirmed cases every day over a prolonged period, we'll exhaust all the isolation facilities soon, and then patients will pack the accident and emergency wards again. So we are now in discussion with the government We would like to boost the capacity of isolation facility as soon as possible. And then in hospitals, we have also converted many indoor facilities. And then we have also curtailed non-emergency services at our clinics and other day centers. So in future, these facilities will be used for holding patients who wait for treatment. And then in the past 2 days, we have been making an appeal to the private sector to join us in the fight against the epidemic, and we're grateful to private practitioners for their positive response. Now, I would like to give the WhatsApp number again, 9788888960. So we have enhanced the WhatsApp system again. Now, if private practitioners just upload their practicing certificate and the WhatsApp group, then we'll have staff contacting them on the work arrangement. And this morning, we WhatsApp 3 private practitioners this morning, and in the afternoon already, they have signed a contract and they have started work at the hotline service. So we appeal to private practitioners to join us in our fight against the epidemic. Over 160 of our employees are preliminary positive cases. They have been infected either in the community or in their own homes. And then there are 30-odd patients screened to be preliminary positive when they were admitted to hospitals. So some 60 patients in the same ward are listed as close contact. And then the Hong Kong Red Cross Center has received notice of blood donor who is now a confirmed case. On the 27th of January, the donor gave blood at the West Kowloon Station. The blood he gave was turned into 3 blood products. Blood platelets was used on a patient in Tuen Mun for the red blood cells. They were used on another patient at Yan Chai Hospital. The healthcare team will follow up on these cases. And for these 2 patients, so far, they tested negative. As for the blood plasma is not being used, the center is already recovered we recovered that blood plasma product.
So far, we have 7,400 preliminary positive cases. The floor is now open to questions. Please put up your hand. Our staff will pass you the microphone. Before putting your questions, please identify your media outlet. The journalist, the gentleman over there, RTHK. Question for Dr. Chuang. About the Shengshui slaughterhouse, the infection cases there, do we see any increase in infections there? And for the state